Welcome to the Smart Weight Loss Coaching Podcast. I'm Dr. Lisa Oldson, a board-certified weight loss medicine specialist and certified life coach. In this podcast, I'll share fresh insights and effective techniques for incorporating mindset, habit change, and proven science into your life. Are you ready to achieve sustainable weight loss, wellness, and longevity? Then let's jump in and lose weight the smart way. Welcome back. Today we're going to talk about insulin resistance and polycystic ovarian syndrome, also known as PCOS. Even if you don't have PCOS, you'll find a lot of things we do to manage it can benefit everyone who's on a journey for better health and longevity. PCOS is the most common endocrine problem in women of reproductive age. And interestingly enough, it doesn't disappear with the onset of menopause. In my experience, PCOS in the postmenopausal woman is often ignored or overlooked since the reproductive aspects of it are no longer relevant. After menopause, the diagnosis is rarely considered, but it can exacerbate some of the chronic cardiometabolic conditions that increase later in life. Polycystic ovarian syndrome is linked to heart disease, stroke, and metabolic problems like diabetes. It can cause acne, male pattern hair growth, problems with fertility, hormones, irregular periods, and weight gain, especially around the abdomen or belly. According to recent research, PCOS has also been associated with higher rates of depression, anxiety, eating disorders, low self-esteem, and body image distress, leading to reduced quality of life. If you have PCOS, prediabetes, or type 2 diabetes, you already have some insulin resistance. But I think most people find the term a bit confusing, so I've got an easy way to help you understand the concept of insulin resistance. This story involves my grandmother. But first, just a quick reminder that your pancreas is an organ at the top of your abdomen that makes insulin in response to sugar. Not just from eating a sugary dessert, but in response to eating in general. All carbs, including fruits, vegetables, and whole grains, in addition to non-nutritive foods like chips and candy, are eventually broken down into sugars during digestion. So basically, if you eat, you're releasing insulin. But of course, straight-up ultra-processed treats or sugary foods will result in a higher spike of insulin. Now, I want you to think about my grandma, we'll call her Grandma Dot, as an insulin molecule. Stay with me here. I'm specifically remembering one summer I visited her in Williamsburg, Virginia when I was about 10 years old. I think Grandma Dot was worried that I'd be bored without friends to hang out with, so she hatched a classic Grandma Dot plan. Now you're imagining Grandma Dot as an insulin molecule, and then please imagine the houses of all her neighbors who had kids anywhere from age 7 to 15 as muscle cells. Have you got that? Grandma Dot is the insulin, and each neighbor's house is a muscle cell. I'm the glucose, the molecule of sugar. Grandma Dot grabs me by the hand and marches me around her neighborhood over to the front door of her neighbor's house, just like insulin takes the glucose and heads to the muscle cell. Grandma Dot knocks, and when someone answers, to my mortification, she essentially shoves me forward, introduces me to the kid who may or may not be remotely near me in age, and encourages me to go inside to play and make a new friend. Similarly, insulin knocks on the door of the muscle cell, and when the door is open, it nudges the glucose to go inside. As soon as I thought of this analogy, I honestly couldn't get it out of my head. I mean, I'm both traumatized and appreciative of all the nudging Grandma Dot did to connect me to other kids in her neighborhood that summer. And ever since I thought of this comparison, I think insulin's role in bringing sugar to the molecules so it can be used for energy is easier to visualize. When we're insulin resistant, that means no one's answering the door. It's like they don't hear the knock or they're ignoring Grandma Dot. So the glucose or sugar starts to pile up, and the pancreas responds by releasing more and more insulin. So suddenly, Grandma Dot and all of her bridge playing friends are all banging on the same door of the muscle cell to try to get it to open up and take in the sugar. But here's the problem with all of the insulin knocking on the muscle door. Insulin happens to be a weight gain hormone. So suddenly we have too much insulin and we have too much glucose or sugar floating around. And that insulin resistance can lead to prediabetes, type 2 diabetes, weight gain, and other problems. And as I mentioned, it's a part of polycystic ovarian syndrome too. Personally, I worry about this because I have prediabetes, which is an early stage of insulin resistance. So again, how does all this relate to polycystic ovarian syndrome? Well, insulin resistance is a common feature of PCOS. Although genetics and epigenetics contribute to PCOS, there are other factors at play too. Research shows that diet and lifestyle, environmental pollutants, change in our gut microbiome, neuroendocrine, meaning brain and hormone alterations, and excess weight are all among the modifiable risk factors that predispose women to PCOS. We don't really know all the reasons why PCOS happens, but what we do know is that women with PCOS are more vulnerable to cardiometabolic problems, fertility issues, menstrual irregularities, and androgen excess, meaning symptoms that suggest an excess of male hormones, like acne, hair in unwanted places, and so on. Sometimes women do have multiple cysts on their ovaries, hence the name, but the cysts are not really the main issue with PCOS, despite the name of the syndrome, and the identification of ovarian cysts isn't necessarily required to make the diagnosis. Today, I'm not going to spend time going into how PCOS is diagnosed, because it can be a complex diagnosis to make. Rather, I'm going to talk about the intersection of PCOS with weight issues and insulin resistance. About half of the women with PCOS have the disease of obesity, meaning a BMI of 30 or higher, and more than half carry their weight around their waists, which we call central obesity. This is the most dangerous place to carry our weight when it comes to health. When excess weight is deposited around the organs in our abdomen, that kind of fat tissue distribution is called visceral fat. The excess testosterone in women with PCOS leads to that central weight gain or visceral fat accumulation. Carrying excess weight makes us more vulnerable to developing PCOS, but also women with PCOS are more prone to weight gain. It's a chicken or egg situation. With every 1 point increase in our BMI, we have more than a 9% increased risk for developing PCOS. Let's look at some of the hormone changes in PCOS that contribute to weight gain. Leptin, which is an important hormone for weight management, signals us when we've had enough to eat. We say it's the satiety or fullness hormone. In PCOS, insulin resistance can contribute to leptin resistance. So just like Grandma Dot, representing insulin, can be knocking on the door of the muscle cell to no avail, leading to more and more knocking and more insulin building up without the door ever opening, the same can happen with leptin. If too much insulin leads to insulin resistance and eventually leptin resistance, suddenly our fullness signal is banging on the door trying to be heard, but we just don't recognize that knocking. The result is we don't feel as satisfied when we eat, and we eat more, causing weight gain. Now, what about our adrenal glands? These hormone-producing glands sit above our kidneys and are involved in releasing cortisol and also some androgen or male hormones. Too much insulin can cause overstimulation of the adrenal glands, which contributes to the release of excess cortisol. We've talked about cortisol here before. It's a stress hormone. Well, cortisol, like insulin, can cause visceral fat storage or central weight gain. Again, meaning depositing fat or adipose tissue around our abdominal organs, giving us more of an apple than a pear shape. What about ghrelin, our hunger hormone? Typically, as we eat, we begin to suppress ghrelin so that by the time we finish eating, we're no longer receiving any hunger signals. In PCOS, women have a decreased reduction in ghrelin when they eat, so they feel hungrier for longer after starting to eat. Since they don't feel as satisfied, they may eat more. That's not a lack of discipline, that's a hormonally driven desire to eat more. You've heard me say before that excess weight isn't your fault. All of these hormone changes in PCOS should really drive home that point. By now, I feel like most people are familiar with the GLP-1 medications like Ozempic, Wegovy, Zepbound, and Mounjaro. We all have natural GLP-1 hormones in our own bodies, even when we're not taking weight loss medications. And these natural GLP-1 hormones impact satiety or fullness. In PCOS, GLP-1 secretion may be reduced, so we want to eat again sooner than expected after our last meal. One last point about the impact of PCOS on our health. Not only do women with PCOS have more susceptibility to weight gain, have ovarian and adrenal gland changes, and have excess androgens or male hormones, they may also have more inflammation. Insulin resistance drives inflammation, and we know that inflammation contributes to a higher risk for heart disease, stroke, cancer, and other health problems that we see in people who have insulin resistance and carry excess weight. I don't want you to think this is all doom and gloom. I have some pearls to share about how to manage PCOS, insulin resistance, and the excess weight related to these conditions. But before we talk about treatment, let's pause for a word from our sponsor. Haha, just kidding. It's still me, Dr. Lisa Oldson, founder of Smart Weight Loss Coaching. If you're as focused on your health as you are on the scale, you're my person. In my online program, we'll help you establish healthy habits for weight loss, better health, and longevity. For those of you who have looked at our website before, you'll be excited to see that you no longer have to commit to a 3-month program to join us. If you'd like to learn more about our affordable monthly membership, head over to smartweightlosscoaching.com. And we're back. We were just talking about the relationship between PCOS, insulin resistance, weight gain, and inflammation. It's daunting to realize that so many women are dealing with this syndrome. But of course, I'm not going to leave you on a depressing note. There are definitely things we can do to manage PCOS. Following a healthy nutrition plan is critically important, but it turns out that the research is divided on how we should eat to manage PCOS. Rather than throwing up our hands and concluding that we don't know how to eat for this syndrome, I'd summarize the research on dietary changes for PCOS like this. There is not one superior dietary pattern to follow if you have PCOS, which is great news. Many dietary patterns have some research supporting their effectiveness for improving outcomes in PCOS, including the Mediterranean diet, ketogenic diet, time-restricted feeding, the DASH diet, and one of my favorites, the whole food plant-based diet. When so many different dietary patterns show promise for managing PCOS and insulin resistance, it's worth noting what they have in common. You'll want to work on these 5 things to manage your symptoms. Number 1, limit refined carbs like sweets, pastries, and baked goods made with white flour and sugar. Although that's good advice for all of us, this makes an outsized difference in women with PCOS and in people with insulin resistance. Number 2, get enough protein. We've talked about this in a few episodes, so we won't do a deep dive here. Keep it simple and just ask yourself, what's my protein with each meal to ensure you're fueling your body with adequate protein. Number 3, eat more fiber. I can't stress this enough. The average American diet contains about 16 grams of fiber, but the dietary recommendations are to get 25 to 30 grams of fiber per day. You can get your fiber from beans, veggies, fruits, nuts, seeds, and whole grains like oatmeal and quinoa. Number 4, eat nutrient-dense foods. Ideally, we should be getting our vitamins and minerals from the foods we eat. Taking a vitamin or supplements is not the same as eating foods rich in micronutrients. And number 5, Ensure you're getting adequate amounts of essential fatty acids, meaning omega-3s and omega-6s. You can get your omega-3s by eating salmon and other fatty fish like tuna, as well as from chia seeds, walnuts, and flax seeds. Omega-6s also come from eating walnuts, pine nuts, sunflower seeds, and hemp seeds. Personally, I love to throw these nuts and seeds on my plain Greek yogurt with fresh or frozen berries. Let's talk about exercise for PCOS. I'd like to say that exercise unequivocally improves outcomes in PCOS, but the fact is that there are some mixed results from the research. We definitely do see studies that support what we know to be true in prediabetes and diabetes, which is that exercise sensitizes us to insulin and improves insulin resistance. It can also reduce waist circumference, meaning we carry less weight around our middles, and reduces cardiovascular disease, even when the exercise doesn't lead to weight loss. With PCOS studies, not every study finds exercise to be a game changer, but in my opinion, we're wise to exercise for our health and to improve insulin resistance, even if it doesn't improve all of the symptoms of PCOS. Stay tuned for more on that as we learn more from the research. There may also be a role for medication, including metformin, inositol, birth control pills, and probably also the new GLP-1 agonists, although they're not currently FDA approved specifically for PCOS at this time. What about weight loss as a treatment for PCOS? It's been studied, of course, and there are some things that improve with weight loss, including insulin resistance, androgen or male hormone levels, and menstrual frequency. Weight loss isn't easy, especially for women with PCOS, but it is possible. I have a lot of women in my program with PCOS, and I've seen some wonderful success stories. With up to 12% of women of reproductive age living with PCOS, and with the incontrovertible link between this syndrome and excess weight, I hope you found it worthwhile to learn more about it today. Whether you have PCOS, prediabetes, carry excess weight, or are interested in preventing these issues, there are several things you might choose for your NBA, your next best action for today. You might consider eating more fiber, more protein, or fewer sweets. You might consider taking a walk after eating, which has been shown to help with insulin resistance. Or perhaps you're ready to dive into more vigorous exercise to improve your metabolic state, even if you don't lose weight from it. Perhaps you want to talk with your doctor about testing for PCOS or screening for diabetes or insulin resistance. Just remember that you don't have to do everything all at once. Start wherever you are and just choose one new thing you can do today, one next best action to improve your metabolic health. Thanks so much for listening. If you'd like more support during your smart weight loss journey, check out our group coaching program at smartweightlosscoaching.com. Until next time, stay well and stay smart.